after 9:30, so we'll get started. Thank you for coming to the extra coffee hour that we had this month. We welcome Parkview Pharmacy today, so if you haven't already grabbed a bagel and some coffee, it's a nice treat and something different for us today. So I will introduce them in a moment. The only announcements I had, I know it's been advertised around campus, but don't forget about Joanne Filetta this coming Tuesday, April 2nd. She'll be right here in the event center at 3 p.m. So we're really excited to have her. I anticipate a full house, so please come on down for that. And our speaker for coffee hour next week is Mr. Robert Goller. He is the town of Aurora historian. So Sue Oliver was able to get him to come here and speak to us. So please come to coffee hour next Friday, April 5th, and hear from him. Do we have any resident announcements? Okay, well then I would like to introduce Megan and Tom. They are both here from Parkview Pharmacy to talk about the Adhere 360 program.
Good morning, everybody. Good morning. How are you? Did everybody get coffee and bagels? Yes. If I heard no, somebody's got to go get Cinnamon Crunch. So good. Well, thank you. My name is Megan Schobert. I'm from Parkview Health Services. This is Tom DePalma. We appreciate you guys having us this morning. And we just kind of wanted to talk to you guys about medication management, what you guys are doing now, how we can help you, and just kind of get a better understanding of the concerns that are going on. If you guys don't take your meds, if you guys take too many of your meds, our goal is to keep you here. We want to keep you here in your apartments and independent as possible, but a lot of that has to, you got to focus on taking your medications. I'm actually going to let Tom jump in and talk about an experience with his mom, and then we'll talk about the program a little bit.
Thank you, Megan. Hello, good morning.
Good morning.
Two stories that I'll tell real quickly. The first one actually started. The first story I want to tell today actually involved my father. So my father lived independently in the home that we grew up with for many years. It had got to the point where he was on probably a dozen or so different medications. And my mom was sick, so she was at the hospital and she was recovering, and so we had those pill organizers in with all the different compartments for the day of the week and the time of the day, and we organized that all for him. And we had Comfort Keepers, which was a companion that would come in and just spend some time with him during the day, because we were with mom and working and shuffling things around with our families. And we would swing by later in the day. Well, I swung by mid-afternoon one day, and I looked at the pill organizer for Monday. It was Monday, and all the pills were gone. So I said, Dad, what happened with Monday? And he said, well, I took my pills this morning with my coffee and my bagel, and I was talking with my Army buddy that was the fellow from Comfort Keepers. Well, he took all the medications at the same time. So we called the doctor. The doctor said, well, that's not good, bring him in. So we brought him in. He ended up being fine, but it was a scary moment. So we realized at that point in time that was probably not the best solution, because there wasn't an individual that was actually allowed to administer the medications, but having those organizers wasn't the best solution. And fast forward, my mom, who's just turned 90, she lived independently for 10 years after my father passed, and she refused to have any assistance with her medication. My sister convinced her that she'll help her with the organizer, and she would spend a couple of months down in Florida about this time of the year, and she would come back. But while she was there, I went to visit her with my wife, and we took a look at her pill organizer, and it was for the whole month. And I noticed that there were several compartments that had passed that still had pills in them. And I'm like, Mom, why are these pills still here? She goes, oh, those were extras that Lisa packed. I'm like, she didn't pack extras. So she wasn't taking her medications appropriately. She had, you know, some issues with regards to that. But my whole point with this is there's a solution that would have worked better for them and would have worked better for us, so that we have some peace of mind and assurance that it's not as confusing to take those medications. So Megan's going to talk a little bit about the Adhere 360 program, but it is really about organizing all of your oral medications, including supplements and vitamins, because Mom likes to have those. We can organize them all in the right containers, and have them in individualized pouches with an easy opening strip that has the day of the week, the time of administration. It has stickers on the side so that family members can see that this is all the medications that are synchronized for you for ease of administration. And all of that can be done in a 28-day supply. You just grab the next strip, and if somebody wants to say, hey, are you current? You can easily show up the next one on the strip and be able to see what's coming up next, and indeed that it's current. So that's just a little bit about what we do, and some personal stories with regards to my own mom and dad, and Mom's doing great now. She's actually in a facility like this. On the assisted side, and I live in Rochester, and after touring this campus, I really wish that she lived in Buffalo. It's a beautiful place, so thank you for having us.
Okay, thank you guys. So I'm gonna have Tom just kind of show this box here. So raise your hand if most of you probably have like the standard pill containers, brown ones with the white tops. It's usually what everybody has, and whether you get it from a corner pharmacy, Rite Aid, CVS, that's generally what basically everybody has. Whether you have one pill bottle or 10, it's a lot for you guys to have to worry about. So what we've done is we've put this program into place. They're little pouches. I'm gonna have Tom kind of, and they're broken out by your morning meds, afternoon meds, if you have them, and your evening meds. So you're not opening up multiple pill bottles. All of your meds and your vitamins are in one pouch. You open up the pouch, take the meds, you're done. What's nice about it is this whole box gets delivered right to you free every month. We take care of putting everything in there. All you have to do is take your meds. So it's nice. It takes the ease out of, even if you have 2 pill bottles, you're managing those meds and sometimes saying, did I take them? Did I not take them? And it's a lot to put on you guys. If you don't take one of your meds, let's just say you have CHF, you don't take your med, you can go right back to the hospital. We don't want you to go to the hospital. We want to keep you here. So this amazing, I'm going to have Tom kind of take one off here. It rips off super easily, opens easily. Right now there's Skittles in there. If anybody wants Skittles, let me know. But again, this is it. So some people have 2 pills in there, some people have 20 pills in there, including their vitamins. It's just up to what you have going on, but you don't have to worry about it. And again, it comes in this blue box, and every 28 days, we ship you a new box. We bring it right here. You do not need to go to the pharmacy anymore. How many of you struggle to get to the pharmacy? Or maybe pick up your meds on time? Okay, so how many get them delivered? Okay, and who do you generally get them delivered from? Rite Aid? The one in Orchard Park. Okay, and are you guys getting the standard pill bottles from there? Okay, and honestly, you guys, when we talk about this, it's not to tell you you have to switch. It's to give you information that if this works better for you, and we can put all those medications in a pouch, and it makes it easier for you to take them, that's what we would like to do to help you. We're not here to force you to change. It's just a recommendation if it helps you make things easier. Any questions? Yes?
What do we do with the box that's empty?
When the box is done, you can just throw it out.
Put it in recycle?
It's recycled.
It's recycled, yes. And so go ahead.
Yeah, who does what when, if in the middle of the month,
The doctor changes my prescription.
Repeat the question, please.
So the question was, what happens in the middle of the month if a physician changes your prescription? Very, very, very good question. The answer is, depending on what it is, if it's something where they're changing 25 milligrams to 50 milligrams, and it can wait until your next box, they'll do it. If it's something like an antibiotic that you need right away, we'll bring it right out here. So we'll talk with the physician, figure out, can it wait 2 days, can it wait a week? Does it have to come today? We'll talk with the physician and make sure we meet the needs of what they need for you guys. Yes?
So take it that all of the prescriptions then would be transferred to your company?
Yeah, okay, so did everybody hear that question? It was, if this is something you guys decide to do, would all the prescriptions be transferred over? The answer is yes. So our staff does everything. When I say you guys don't have to do anything outside of just give us your basic information, our staff goes to the physicians and we synchronize the meds, we take care of everything, and we get the delivery out to you. Yes?
So basically what you're saying is that if we had a flu and they ordered an antibiotic, that would be a different prescription, and you would send that one out?
That is correct, yes. So the question was, in case you guys didn't hear, let's just say somebody got sick, you guys needed an antibiotic. Would that come separately right away when you needed it? The answer is yes. If it's obviously something that's super important for you guys, we will just deliver it that day or the next day. Yes, right.
Hi.
Hi.
I have a question. So
Sure.
for me, I was taking 200. I was taking 2 green skills a day,
Okay.
and the doctor discontinues that.
Yep.
So then what happens? How do those all get out of those packets?
So basically, our staff will talk to you guys and tell them the pills that just need to be removed, that they shouldn't take anymore. They explain the color. There's actually like a form in there that they get every month that has the color of the pill, when they should be taking it. They just tell them, do not take this pill anymore.
We already have they've already come.
They've already come, correct. And if that changes,
So,
go ahead.
okay, so we already have them in our blue box, and the doctor decides we don't need them, they're already there.
Correct. They'll be, if that's something we're halfway through the month, they tell you that it would be like if you had it in the pill bottle. You just don't take it anymore.
Okay.
Yes.
Supposing I want to have you add a cranberry
Yep.
supplement, and I want cranberry gel caps, not cranberry capsules.
Yep.
You can do that?
We can do that, yeah. The good thing about being a specialty pharmacy that we are is we have that inventory. We have a larger base inventory. So we've got, if you needed 50 different kinds of toothpaste, we have it. So yes, you can definitely accommodate that. Yes.
What happens if we are going to go away for 3 or 4 weeks and say,
They can ship it to where you're going.
what if you're moving around though? Or on a ship, for example?
Well, if you're going on a ship, I'm going with you.
So the nice thing about the strips is, if you're going away on a trip, you can grab those pills that are on that strip for the time that you're gonna be away. And if it's in the middle of the month and you need to have another 2 weeks, you just have to contact the pharmacy, and we'll make sure that we give you the additional that you'll need, because this comes in a 28-day shipment. The reason why we do 28 days and not the full month, because some months have 31 days, some have fewer. This way, you know that you're getting your next box on the same day of the week consistently for the next 28 days.
The reason I'm asking, because right now, the insurance company gives us a 30-day or 90-day supply. So, and then they allow you to get it again about 9 days earlier than that, so you can think about when you're gonna be away and sort of build up a supply on your own right now.
And that would be the same feature, if you're going somewhere, what we'll do is we'll work with the insurance company to let them know what's going on with you. So our staff, they do all the prior authorizations, they have the conversations with the insurance company. Like Tom said, we would just set you up, and there are people that go to Florida 4 months out of the year. We'll ship their meds to Florida, as long as we know what's going on and we're having that communication with you. Yes?
How are payments made?
It's really the same thing, so there's no charge for the program. So you'd have a copay for your normal meds that you do right now. You can pay over the phone with a credit card, we'll take care of it. Most people usually just call with their debit card or credit card.
To you?
Yeah, we would give you the office number, yes, yes,
You do Medicare and TRICARE for life?
we do. Yes. Man, I love you guys, you have so many great questions, I'm like super impressed.
Okay, now, is the rate for the medication the same as I pay for CVS Caremark?
Yes, everything is exactly the same. So what you envision is what you're getting charged right now, which is probably just your copay, is gonna be exactly the same with us. Yes.
I'm not sure I heard everything at the beginning.
Okay.
My wife has about half a dozen doctors.
Okay.
She has some pills she takes once a day, some twice a day,
Okay.
sometimes 3 times a day. They're all different colors and sizes and everything, and we have this all written out. So I order them at the pharmacy whenever I get low.
Yep.
Yeah. So I'm kind of curious, I'm not quite sure how that works, again, if you wouldn't mind telling me.
You can, by the way, wonderful question. Did everybody hear that before we answer it? So his wife, takes some medications in the morning, some different ones in the afternoon, and some different ones in the evening. He wants to make sure, and right now he's kind of sorting them out. How does that work in our pack? And it's a very good question because not everybody has a standard, I take 2 in the morning, I take 2 in the afternoon, I take 2 in the evening. So, but go ahead if you want to.
Great question, thank you. What differentiates us from a retail community pharmacy is with this program that we call it Cure 360, we provide an enhanced level of service where we have a specially trained customer service department. We call them patient advocates. And what the advocacy team will do in this particular instance with your wife is if there's multiple providers, specialists, primary care, we will go through a process called med synchronization. So our team would work with all of the individual prescribers to coordinate those medications so that they're all, it may take a month to get there because could be many of them, but by the second cycle, we'll have all those synchronized so that they're coming together in the same box for that 28-day period. The patient advocacy team will also reach out to every one of the individuals at least once a month just to see how are things going. Is this working well for you? What other types of things are you concerned with? Oh, you want to add an additional supplement. We'll put that on the order. We'll talk to your doctor to make sure we have that order. We'll get it added for the next cycle. So that's what's really different is that advocacy team.
Hi, I have another question. So say my doctor ordered an antibiotic for me, and it's maybe like Tuesday at 2 o'clock in the afternoon, and they send the order over for an antibiotic. How quickly will that antibiotic get here for me then?
So we would just want to make sure, obviously if it's an antibiotic, we want to make it stat. So our deliveries basically go, 8, 9, 10 at night. If it comes in at 2 and you note it as stat, we'll make sure that we get it out that evening.
Do you deliver on the weekends?
We do deliver on the weekends. Yes, very good question, thank you. Yes. Either one.
Okay. These places that I consider pharmacy warehouses are always trying to get you to save money. And one of the ways that they do it is to give you a 90-day supply. Therefore, they'll say, oh, we're gonna save you $10 or some ridiculous thing. I can have my own physician prescribe 90 days.
I'm gonna jump in, and you might not like my answer. We don't like doing 90 days. And I'll tell you why, because so much can change with you in 90 days. You're never gonna see us doing a 90-day cycle. You're gonna hear from us probably every 21 days, checking in with you, asking you, hey, what's going on? How you feeling? Do you have any falls? How's everything going with the medication? Did you go to the primary care physician? You're gonna have a patient advocate that's talking to you, then bringing it back to our pharmacist and saying, hey, this is new, this came up. Say you did have a fall. We'll go back here to Fox Run and say, hey, this is what they told us on the phone. It's not about 90 days supply, it's about checking in with you, making sure things that have or haven't changed, and taking care of you every month. So it's gonna be very different with us. Yes?
What if you are allergic to the thing that comes to you and you have all these extra pills? And you can't use them?
Allergic to,
The pills that came, the new ones. Like if you had an antibiotic that you reacted to.
I mean, will we just pick it up for them, Tom? Like if they were?
Do you send them back? Or you have all these extra ones?
Yeah, I mean, if it's something where you have an allergic reaction, we could have like our driver just pick those up to get them out of your apartment if something like that happened.
Yeah, I mean, what would happen is you would reach out to your medical care provider and tell them you had a reaction. They would discontinue the medication. You can also contact the pharmacy, and if it's in
I just wonder if a new prescription, they could, I usually ask for only a few pills in case I am allergic to.
And if your doctor writes for it that way, like if your doctor writes the script that way for 5 pills, that's exactly what we'll fill. So whatever your doctor writes for is exactly what our pharmacists and our techs are gonna fill for. Yes?
Yeah, I wanted to button onto her comment about saving the money.
Yeah.
One of my wife's pills is about $400 or $500. The copay itself is $100, and so the doctor orders, 90 pills, and we cut them in half.
Right.
That's a way to save it,
Right.
okay? Now, you sound like you don't want to do that kind of thing at all.
If the doctor writes it that way, so there are some, so it's almost like 2 different questions a little bit. There are some places that they say, hey, just get a 90-day supply. In your situation, if the doctor's writing for that, that is exactly what we'll do. Our goal isn't to send 90 days, because again, so much can change with you individually. If it's written that way, that's exactly what we'll do. Okay? Yes, Jared.
What about vitamins?
Very good. Janice said, what about vitamins? Vitamins can be included in the package that Tom has here. So if you want to take your vitamins in the morning, 4 of them, 2 in the afternoon, we'll put them in the morning, afternoon, and evening packages for you.
Can I just clarify the 90 days? So you can
Yeah.
still get 90 days, they just don't all come at once. So you can save on your copay,
That's
I
correct.
presume, but they'll just come 28 days at a time.
That's correct.
So you're not losing out on the 90-day
Yes.
option, you're just not getting 90 pills in your apartment at once, you're getting 28 at a time.
And again, the answer, thank you, Bill, for clarifying that, is because again, and if we send it in the 3 months in the boxes, right, that's fine. But if something changes or gets discontinued or you're having issues, we just don't want to just keep giving you medications, right? We want to look at you and your medications monthly and see if we can help you. So our pharmacists, their goal, if somebody's on 20 meds, we don't want you on 20 meds. We want to really look at the 6 doctors that you have and say, is this necessary, right? We want to take, the more meds you take sometimes, unless they're 100%, could cause falls, right? So we want to make sure we're helping you with this and not just sending meds. Yes?
For over-the-counter drugs, the brand names versus the generic, would you send either one, whichever preference, like Caltrate versus whatever the calcium supplement is from the store brand?
It's a super good question. So the question was like, say the over-the-counters. So we have the brands and we have the generics. And something like that, we're gonna talk to you. If you want the Caltrate and you do not want the generic, that's what we're gonna send. If you don't care, we'll do the generic if it saves you a little bit of money, but we'll get that insight from you. But we can send both, or one, or either. Yes?
How do you deal with medicines that aren't in pill form? There's the nasal sprays and the liquid medicines.
Same thing, those would just come, they would come with your delivery, just obviously not in the box. Correct, very good question.
So if I just needed antibiotics for 7 days, it would come in like a strip of 7 days?
Yes, so they'll just fill that, like, again, if the doctor writes for an antibiotic for just 7 days, that is all we're gonna fill.
Right.
Right, it's usually
It would come
10.
in a pill bottle, it would come in like a strip, and if it's,
Yeah,
you
what,
need to take this antibiotic twice a day, every 12 hours, it would come in already labeled, just in a strip.
and with those one-offs, those PRNs, those special requests that are not part of a monthly routine fill, it's really about personal preference. So if you want it in a vial, we can put it in a vial. If you want it in a strip pack, we can put it in a strip pack.
By the way, I'm bringing all of you guys with me. You guys are fantastic. This is great.
Can I borrow a mic?
Yeah.
I just want to give a little background to how Parkview came to Fox Run. So, as we listen to all of you as to what goes right and what goes wrong, we know you get a great delivery service from a local pharmacy. We also know many of you have insurances that aren't covered by the local pharmacy, and you have to use, I'll call it a big box store, like a Walgreens or a CVS. And we've heard stories about those larger pharmacies using third-party drivers where they're leaving bags of pills at the north entrance on the ground and hoping that somebody picks them up. That can't happen. I know Anthony Brown does a great job of going through Pamela. We wanted to give you all another option for you to choose. You can choose whoever you want. You can stick with a CVS or Walgreens, but as we were introduced to Parkview, and this introduction was made through many of our competitors in similar communities who already use them. They're a local pharmacy that kind of grew up, so they have the capabilities of and I'll let you guys give your history, I'm hoping you can do that. The capability of a larger organization like a Buffalo Pharmacy that's local, but also the personal touch of someone smaller and local. And we've found this through others' experience, and we visited actually their offices and where all the pills are put in these packets. There's a group of us, including Allie, our health center administrator, wearing bunny ears in the back. But it was really an impressive operation, and although I don't think anyone can solve every specific preference or problem anyone has, I think what we found there is this is a nice option to cover most, if not all of them. So again, this is just another option we wanted to bring in for all of you, and we're going to actually share this with our health center as well. So I'm kind of hoping I'm going to give the mic back, and it's really hard for me to do that. And maybe you can give us a little history on Parkview and how you came about it.
Yeah. Todd, do you want to take the reins on this?
Parkview was established in 1985, so we're getting close to our 40th anniversary coming up soon. It was established by a few brothers by the last name of O'Leary, and they had the aspirations of being the next Walgreens or CVS. They had a little mom and pop pharmacy. It was full retail. They sold everything from windshield washer fluid to over-the-counter medications. And within a fairly short period of time, there was a realization that that really wasn't the path that they wanted to go down. And they made a pivot and decided to be licensed and credentialed as a long-term care specialty pharmacy. And there was a fairly significant group servicing the developmentally disabled community, and that community had a lot of group homes in the area, and they were having a lot of challenges getting medications for their residents. They would have outings where they would take the individuals into the community to get their medications, and it was not going well. And what we decided to do is, well, hey, let's come up with a program where we can provide cycle fills, get all your prescription information, and we'll deliver them in a batch format for all of the group homes. They were so amazed, and then we ended up integrating with their medical records, and the program grew. So from that time where we were a specialty long-term care pharmacy, we merged and grew from the developmentally disabled to assisted living. Now it's the full continuum of care, independent, assisted, long-term care, skilled. Still doing the developmentally disabled and a whole lot in the behavioral health space. And what we do is, as we've grown over that period of time, is we've added the staffing and the touch points. If your provider calls us, they're not going to go into a phone jail where you're going to be in this endless cycle of waiting. The same thing for you. You're going to speak to a live person. We have over 30 licensed pharmacists, many support staff, and our drivers are fully contracted and licensed for Parkview, and they're going to deliver medications with a signature. They're not going to drop them off. They're not going to stick them in a mailbox. Somebody's going to need to sign for them so that we have that nice handoff and assurance that the medications are arriving where they need to go.
I have a quick question. I took a brochure from the back, which says very clearly Riverview. I don't see an address or a phone number, and it's using the terminology add here packs. So I haven't heard you mention any of that, and I'm sure it was in your presentation, but you did not refer to the verbiage that you just said.
So it's a very good question. So Parkview Health Services is our parent company, okay? So Tom just spoke about kind of how we started almost 40 years ago and servicing more the facility side. About 6 years ago, we opened Riverview, okay? So the parent company is Parkview. Riverview is really the company that we're talking about today that would be delivering, so that the concept for Riverview is more the medications at home, in the community, taking care of the individual. So you would get, the box would say Riverview, but Parkview Health Services is just our parent company, basically. We're located right out of Amherst.
Amherst?
Yes.
Okay, well, that's what I was curious.
Yes.
And you have a local phone number, I'm sure.
We do, and I've got information to give you guys before you go, and some, I don't know if we put the one-page flyers out, Tom, I gotta look. But I'll pass that out before everybody goes.
I was just curious.
Yeah, no, it's a great question.
Thank you.
You're welcome. Yes.
Yes, right now I'm able to drive, I have my car, and I enjoy getting out, doing my prescriptions, because they coincide that I can pick up the big bundle, you know, all the time. Can you buy into this later? You know, if
sure.
things happen that I can't do this.
So the question was, right now she loves getting out and driving and going to her local pharmacy, and if she decided 2 months from now or a year from now, can I do you can do it at any time. You can do it any hour of any minute. Like, you can also pick it up too if you wanted to. You could drive to Amherst and visit me and see me. Yeah, right? So that would be fine too. Yes.
Hi, 2 questions. The first one is, every once in a while I have something that needs to be compounded. Can you do that?
So we can, and if it's something that we cannot compound in our building, we partner with another pharmacy that does, because sometimes depending on the specialty of it, we may not be able to, but we have a pharmacy 10 minutes down the road that does it, so you wouldn't have to worry about it.
Okay, how about tubes and creams? Because I have psoriasis, so I have creams in addition.
So when you got your delivery, which would be every 28 days, your creams or whenever would come with that. It wouldn't be in the box, it would just be separate.
Okay.
Yeah, this is just fantastic. You guys are like on it. Yes.
When you have multiple prescriptions, sometimes they interact with each other,
Yes.
and you can't take them at the same time, or they just conflict.
Yep.
Do your pharmacists monitor that?
Fantastic question. Gosh, you guys are like smarter than me. So the question was like, if there's multiple medications, are our pharmacists looking at potential interactions? And the answer is yes. And here's what really was one of the biggest things for me too when I got hired for the pharmacy is that if you envision a local Walgreens or CVS, there's usually the pharmacist that's standing up and there's one or two of them. Our pharmacists actually are in a quiet area and they're not filling meds. They're looking at the computer screen and analyzing what you guys take and making sure if there is an interaction, they're reaching out to the physicians. So they're in a quiet space where they can really focus on you guys.
And they tell you, for example, take this with food or do not take it with
Yes.
food, you get all that.
100%. And it would also be on the side of the box with those labels there. And then Tom, do you want to take that piece of paper out that's in it to show them what that's like? So on top of the box, and obviously the little pill pouches, this is, we'll pass it around too. So this would be the list of your meds, okay? And it basically just says what it is, and then it tells you, for example, take one pill by mouth twice daily. But it also outlines one in the morning and one in the evening. But your next pill would say only one in the morning. So it's even a double check for you guys. I love this. People keep it right on their fridge. And it's that double check that you, okay, yeah, that's right, I have to take 2 of these, but only 1 of these in the morning. So, and it's color coded for you guys. Yes.
So you have to, it will be on that sheet if you need to take it 30 minutes before you eat?
So that would be on the side there, your little, that's almost, that piece right there is almost like what you see on the pill bottles, you know, it's wrapped around. That's pretty much what that is, but it's just a flat label.
That's great, thanks.
Sure, yes.
Are your pills made in the United States?
I have absolutely no idea, you stumped me on that one. I mean, I need to like go and study a little bit here. You guys are amazing. I don't know. I don't do any of the ordering of the pills. I am definitely not a pharmacist. You do not want me to be a pharmacist. I'm sure many are, but I don't know if all of them are. Yes.
Can I come back to the 90-day question?
Sure.
So let's say my doctor prescribes everything for 90 days. So again, if I'm going away, can I get 2 strips at the beginning of a month because I'm going away?
Again, as long as, yes, you'll talk to our team and let them know you're going away. We'll be able, because the thing is, your doctor already sent for the 90 days, right? We're not filling a prescription that your doctor didn't approve. We just like to send it every month, but if you're going away, then we can send, say, 2 of the boxes. Yes.
How do we contact you?
So what I can do is, myself and Tom are gonna stay after, once making sure I covered all your questions. You can sign up today, I can give you information to call me directly. We'll go through that, we'll stay after so we can talk to you guys. Were there any questions that myself or Tom did not answer? Yes, so I got 2 over here, go ahead.
It's kind of a personal question.
Okay.
You're doing a fantastic job. I was going to ask you if you're a pharmacist. You already answered
Yes.
that. Well, how are you qualified to do what you're doing? Because this is an incredible option.
A lot of training that we go through,
Just
basically.
basic training.
Yeah, we go through a lot of training through our company on the program, who we are, who we want to be. And like I said, ironically, our chief operating officer, who's not here, his name's Justin, he left CVS because he felt like there were too many patients. So if you couldn't get to the CVS or you didn't have transportation, they weren't coming to pick up their medication. So a doctor can write a script all day long, but if you're not taking the meds to help you, what was happening is the meds were going back on the shelf, and he saw it happening too often. So he was one of the first people that wanted to create this program to actually help you guys. And then luckily he trains people like me.
So Megan, just to follow up on your background, do you have any experience in long-term care?
I was gonna say that. Megan actually has a degree and has been a skilled nursing administrator. So she has exceptional experience.
Okay.
And also experience in the specialty long-term care pharmacy market for many years.
Okay, that was my answer.
So,
Thank you.
Thank you. I don't like to talk about my experience very much. Tom does it for me.
I was wondering if you do vaccine clinics, like if you would come to.
That is a fantastic question. I'm just gonna book myself here the whole day. The answer is yes, we do flu and COVID. That would be for independent, that's actually the whole campus. We could do flu clinics for you guys. We try to prep in advance, so we have account managers that are just assigned to you guys. They actually plan out the flu clinics months in advance, so you have it on the calendar. We come here with the pharmacist to do the clinics for you guys. And then you get me here, and I make sure, like, I pull up your, arm on your shirt, so you get to see me, which is great. Yes.
Okay, I'm a veteran,
Okay.
and I can get my medication through the VA. But in some cases, I can purchase that medication here at the pharmacy at a cheaper price than what the VA furnishes. How does that compare with your facility on the pricing of the medication, and are you compatible, say, with the VA, or where do we stand on the pricing with medication?
So it's a very good question. Usually the VA, they kind of have their own program that we usually do not touch. If there's items that are cheaper through the other pharmacy, we would look at that and let you know the price. So like we'd have a conversation with you, get that medication, look into the price for you and get that information back.
Okay, okay.
Yes.
Yes. There are some people, I have started the program of Going Green, what would you said the boxes are recyclable.
They are, yes.
What about all those packets that they're coming in?
The packets are also recyclable.
Okay.
Yeah. Going green is good.
Well, I think this has been a wonderful presentation. Thank you all so much for your questions. I know we've been really looking for another pharmacy. I know, like Bill kind of said, we've had some horror stories around here of these big box stores. We actually had someone here whose narcotic was delivered outside one of the entrances here. And it was a big hassle because they couldn't get the narcotic back from the pharmacy. Their family was fighting. They have their own drivers. They're another local company. We're not saying don't support our local pharmacy, but we're looking to give you another option. And I think this is wonderful.
Just one more not a horror story, but I know there's certain insurances that the local delivery pharmacy does not carry, like TRICARE. And I know that personally through my mom who lives in assisted living, so now this is another nice option to have a delivery pharmacy with a local field that does accept that insurance.
Exactly, and Lori and I do see, we talk to families, we talk to some of you whose children or loved ones are filling your pills for you, things like that, and I think this is just a wonderful, wonderful option. So I thank Megan and Tom for your time today. Thank you for the delicious bagels and coffee, and they will be here if you have questions after the presentation today.
And just one last thing, you guys. First of all, thank you for having myself and Tom. And I promise next time I'll bring decaf coffee. I've learned my lesson today. I promise. Thank you. We'll stay here for any other questions.